Hey guys, this is a very short video on 4 mini topics all related to dopamine. Um, they aren't related to each other, but they all are related to your dopamine. So to begin with, which are these 4 mini topics? The first of all is your Tourette disorder. The second one is your schizophrenia. Third one is your antipsychotic drugs, and the fourth is your dopamine receptors. That is your DA receptors. So these four of these are related to dopamine, which you'll find out in uh, this video. So, what is Tourette disorder? Tourette disorder is a psychiatric disorder, but you can, in a sense, you can say it's a movement disorder. So why do we call this as a movement disorder? Movement disorder because there's a increase of dopamine. Too much dopamine and norepinephrine are found in the brain. So especially your nigrostriatal pathways. So over there, when if to be more precise, in this chapter we will talk about just dopamine. So we'll concentrate much more on dopamine rather than concentrating on norepinephrine. But as we know, norepinephrine is also increased in this Tourette disorder. So increased dopamine, as we know, the function of dopamine is to initiate your movement. So if normal amount of dopamine initiates your movement, then too much of dopamine will of course cause hyperactivity state, yeah, hyperkinetic state, hyperactivity. So because we have increased too much dopamine, this is what happen is Tourette disorder. So people is usually kids less than 18 years old, they have this Tourette disorder. And it comprises of motor and vocal tics, yeah, motor tics, like for an example, blinking their eyes or tapping their hands on their laps, continuously in a repetitive manner. So this is what happens. And vocal also, they keep on uh, making grunting and making sounds, those kind of things. So these are tics which usually is seen in this Tourette disorder, and that is because of increased dopamine. So one point which I mentioned in the beginning of this chapter in this video is these all are related to dopamine. So we have an idea Tourette disorder is related to your increased dopamine exam. So now then we will talk about if increased dopamine, if this disorder is due to increased dopamine. So my question is, what you're supposed to how do you treat this disorder? Of course, if the culprit in this disorder is your increased dopamine, of course you need to decrease dopamine in your body so that you can manage this patient. So for that, you need to give drugs which decrease dopamine. So if we are talking about the drugs which decrease dopamine, I'll talk about which are those drugs. Those drugs are antipsychotic drugs. Yeah. So our next topic in this video next is antipsychotic drugs. Now, antipsychotic drugs, their main function is to, suppose this is a presynaptic neuron, presynaptic. This is a postsynaptic neuron. What happens is dopamine through the vesicles, after the increase of your dopamine gets released from the vesicle and all vesicle into your this cleft. So here is the receptor for the dopamine. Yeah. So what happens is dopamine comes and usually it sticks to these receptors here. Dopamine comes and sticks to these receptors, but that's the main function of dopamine. But antipsychotic drugs, what they do is they come and they sit on this receptor and they block these receptors, so your dopamine can get attached to these receptors. Hence, uh, dopamine function is decreased. Yeah, and this is what you wanted in Tourette disorder too. So what happens is, if suppose antipsychotic drugs, what they do is they block the dopamine receptors, hence decreasing your efficacy of your dopamine. Yeah, dopamine doesn't work. So if dopamine doesn't work, what that leads to, 7 points you must know at least. If dopamine doesn't work, what it will cause, of course you know the disease Parkinson. Yeah. So of course, if dopamine in this case blocked due to dopamine receptor and dopamine drugs, antipsychotic drugs, and dopamine antagonist or antipsychotic drugs, same thing. What will happen is your you will get disease like Parkinson. You will have all the signs and symptoms like what happens in Parkinson's. So you can say, in other words, it's a Parkinson, yeah, pseudo Parkinson, which will happen due to antipsychotic drugs. For an example, you will have muscle rigidity, you will have bradykinesia, yeah, you will have resting tremors, yeah. So these will be the things which will happen in your due to antipsychotic drugs, yeah. Another thing is, as we know, dopamine also plays a huge role in your cognitive function, yeah. So if that what is because dopamine increases your psychosis, yeah. So if dopamine is decreased, yeah, you won't feel good, you won't feel that much uh, good thing, you won't feel that much your cognitive function, to be precise, it will be decreased, yeah. Your learning abilities and all that, those will be decreased, but in other words, in another way, at least your psychosis will be decreased. So it helps in your psychosis also. That's why the name also given antipsychotic drugs, yeah. They decrease your psychosis. I'll explain in this video further what psychosis is and all that. So but 2 points to remember is, one is antipsychotic drugs, they will produce your pseudo Parkinson, yeah, your extrapyramidal symptoms, sign and symptoms. uh, in this case, you since antipsychotic drugs are producing your Parkinson, in us, therefore you can also say it is a drug induced Parkinson, yeah. Then antipsychotic drugs will decrease your cognitive function, of course. Then, since we know endocrine and dopamine also plays a huge role in your endocrine function, yeah. For an example, in the case of prolactin, yeah, prolactin. So dopamine, as we know, if dopamine is increased in your body, then prolactin is decreased. So antipsychotic drugs, since they decrease your dopamine, of course your prolactin will increase. That will cause hyperprolactinemia tumors in the your pituitary gland. It can be possible. And in a female, amenorrhea, and in gens, in male, you can have gynecomastia, yeah. These all are due to dopamine endocrine dysfunction. Then in your chemoreceptor trigger zone, which is in your brain stem, over there we know dopamine plays a role in your emesis, yeah. It makes you vomit. So if you give antipsychotic drugs, which I already mentioned, that they will block your dopamine receptors. That means if you block a dopamine receptor, that means you won't have a vomit. So it has a role as a antiemetic. Then, for fifth point is, your dopamine also plays role in um, your temperature control. So if dopamine is blocked, no more dopamine functioning, then you can have increase in your temperature. Dopamine also helps, dopamine, norepinephrine, and other kind of serotonin. These all help in your weight loss, yeah, anorexia. So anorexia, but in this case, since you are blocking the dopamine here, since you are blocking the dopamine through these antipsychotic drugs, you will have weight gain. Then same thing, dyskinesia, which I have already mentioned here in the first thing, extrapyramidal symptoms, yeah. You will have dyskinesia like acute or extra or chronic, yeah. If suppose if it's acute, yeah, acute, you will have dystonia, you can have dystonia. And in chronic, you can have tardive kind of dystonia. So these are the few points important. And as antipsychotic drugs also have a role in your muscarinic blockade and your alpha blocker, yeah. So they can block your muscarinic also and your alpha, yeah. So this is also very important, because if they block, then they can have 3 C's, that are your cardiotoxicity, yeah, your uh, then you have a cardiac toxicity, that what you can have because of your antipsychotic drugs, yeah. C for convulsion too, yeah. So you can have convulsions also. And then, so these are all about antipsychotic drugs. Now let's go about our dopamine receptors, yeah. Dopamine receptors are of two types, basically. There are another, the important one are D1 and D2, yeah. D1 is your GS coupled, yeah, and usually found in the periphery. And D2 receptor is your GI coupled, yeah, kind of inhibition, yeah. D2 is further divided into D2A and D2C. D2C, as I have shown in my another video, I have talked about in another video, what is mesolimbic and what is nigrostriatal. So D2A is found in your nigrostriatal, which is for the movement initiation, and mesolimbic is for your cognitive mood. Yeah. So D2C receptors are found in your mesolimbic system, and D2A is found in your nigrostriatal pathway. So if you block D2A through these antipsychotic drugs, then you will have movement problems. And if you block D2C, then you will have mood problems, like you will have depression and all that, because normally D2C mesolimbic dopamine helps you in reward feeling. Yeah, it also makes you psychosis. Yeah, like uh, hallucination and all that, those kind of things. So D2C can be blocked by clozapine. All right, so this is all about the dopamine receptors. Then we talk about schizophrenia. So schizophrenia itself, schizophrenia can be related to positive and negative symptoms, sign and symptoms. It's all about the positive and negative symptoms. So what are the positive symptoms? Positive symptoms will happen if your dopamine is increased, whereas negative symptoms are due to decrease of your serotonin. So if dopamine is increased, it will have positive symptoms. Positive symptoms we refer in schizophrenia of psychosis. For an example, hallucination, delusion, agitation, disorganized speech and behavior. These all are positive symptoms of schizophrenia, and remember, positive symptoms are due to increase of dopamine, whereas negative symptoms are due to your decrease of serotonin. Yeah. So like anhedonia, inability to feel pleasure, evolution, lack of will and initiative, lack of will. Yeah, your person doesn't feel like doing anything. Then alogia, poverty of speech, doesn't feel like talking, doesn't have words, anything to say. Yeah, lack of interest in the world. So these are the all of depression kind of. Yeah, this makes you depressed. Depression is due to decrease of serotonin, called negative symptoms, and positive symptoms are due to increased dopamine, but these are called psychosis of schizophrenia. So these terms you must know. These are the psychosis and these are the depressed state. Yeah, these both can happen in a schizophrenic patient. Yeah, either this or both of them. So to treat schizophrenia, suppose, then you need to decrease dopamine, and to decrease dopamine, as I already mentioned, you need to give antipsychotic drugs to decrease your psychosis, positive symptoms of schizophrenia. Whereas to treat negative symptoms, it was decreased serotonin. So serotonin will be decreased. Serotonin is decreased in schizophrenia because of this. So you need to treat these negative symptoms, you need to increase serotonin in the body. Yeah, for an example, through SSRI. That's all. Thank you. I'll make another video. It will be much more in detail. Thank you.